Hi, my name is Jasmine Click. I'm a student physical therapist at Advent Health University, and I just wanted to share and explain to you this therapeutic ultrasound technique that I used with our patient today. So with our patient, I decided to perform phonophoresis with Voltaren gel mixed with ultrasound gel as a coupling medium to decrease the patient's inflammation at the left patellar tendon. And I'm sure you know what phonophoresis is, but I just wanted to share with you my understanding of it. So photophoresis is the migration of drug molecules through the skin under the ultrasound transducer. Its major advantages are the introduction of medication to a local area without invasion of the skin and the synergistic interaction of the ultrasound and drugs. Again, I know you probably know what Voltaren gel is as well, but just to share with you my understanding, Voltaren gel, a diclofenac sodium topical gel, it is an over-the-counter medicine now, which is an NSAID used commonly to treat pain and inflamed tissues. It is widely used in clinical practice, especially for painful and inflammatory conditions. So I decided to treat the patient with phonophoresis to enhance the absorption of the Voltaren gel through the skin by using the ultrasound waves to drive the medicine in the skin. So I first cleaned the treatment area, which in our case, it's the patient's left patellar tendon. I cleaned the ultrasound head, and while I did that, I communicated to the patient the contraindications for a pulse ultrasound, which is what I was going to perform as the treatment. I asked if the patient, if she could possibly be pregnant, if she had any suspected or known areas of malignancy, and if she had any hemorrhagic conditions, since these were more of the solid evidence of contraindications. The patient stated no to all of the contraindications I had listed to her, so I continued to educate and explain to the patient what was expected with this treatment. So I told her that I would be applying the Voltaren and ultrasound gel to the affected area, fuse the two gels together using a circular pattern when applying the ultrasound head perpendicular to the treatment area. I use this to use as the medium for the ultrasound because a topical agent is required in order to have the ultrasound sound waves drive the medication through the skin to create its beneficial effects. So I told her that we were going to be using a pulsed non-thermal technique to minimize heating, so she should not be feeling any type of heat, and if she does feel any discomfort, to let me know to see what we can do and if we need to adjust any parameters or if we have to cease the treatment completely. So due to the patellar tendon being more superficial and focusing on decreasing inflammation of the tendon, I use a 3 megahertz frequency with a duty cycle of 20% since it has non-thermal effects. I also started the intensity at 0.5 watt centimeter squared, then progressed to 1 watt centimeter squared, and then I performed this for a total duration of 5 minutes.